Hi ladies, and welcome to today's tutorial. Today we're going to be kicking off and learning about the different types of incontinence. There are a couple of different forms of incontinence, so I want us to start understanding what they are, what the symptoms are, and some of the reasons why we might experience incontinence or leakage. So the first thing I want to kick off with, that leakage is common, but it is not normal. And that's really important because a lot of the time, especially women who've had children, say, oh, I wet myself when I jump or when I cough and when I sneeze. So what I need you to know is that just because it's common and a lot of people say it, it is far from normal, and it is not something that you need to just live with. It is not something that you need to avoid exercise with. It is something that we need to deal with. I am a pelvic health physiotherapist, and it is something that I advise all women because I think at some point in our lives we will all need help from a pelvic health physiotherapist. What we will do in clinic is we will go through your history, we will examine you externally and internally, so that's just looking at your general body movement as well as examining you, your pelvic floor, your internal organs, and we will be able to assess what is happening internally. We'll be able to assess your pelvic floor. These are the muscles that support our organs and stop us from weeing ourselves. And we will be able to give you that one-to-one help, advice, strategy on what needs to go into place to help overcome and eradicate your incontinence symptoms. Bladder and bowel incontinence is frequent. However, if you are experiencing any form of bowel incontinence again, you need to go and see your pelvic health physiotherapist, okay? It's really important because again, it is not normal. And with help, with physio, maybe with referral, we can get to the bottom of what is happening and help reduce, if not get rid of your symptoms, okay? So I'm starting with that strong message because it's really, really important. So we have different types of incontinence, and incontinence means leakage, okay? So if I use the term leakage, I mean incontinence, it's the same. So we can have different types of incontinence. We have stress incontinence. This is when we leak from the bladder, from the bowel, when we cough, when we sneeze, when we jump. And this is one that a lot of women will report. And this is the one that everyone thinks is normal after we give birth. But you know now, it's not normal. Then we have urgency incontinence. This is where you feel the need to go to the toilet, you cannot make it till you go to the bathroom, and you leak before you get there. And again, that's bladder and bowel. You can also have an overactive bladder where you constantly have to go to the toilet and you don't feel like you ever have completely fully emptied. So we have these different types of incontinence, and as we've said, none of them are normal. So what we want to start to do for you is start to work out, what does your picture look like? Everyone will be on a different spectrum. But understanding what your symptoms are, understanding when you experience your leakage can help to paint that really good picture as to where you sit in terms of, is your incontinence quite mild or is it quite severe? And it helps you to start to overcome, as we go through different sections, the things we need to do to look at to help manage your incontinence. Women can experience some urgency as well as some stress incontinence. Again, this is common, but it is not normal. Some women feel the need to get up in the night quite frequently to go to the toilet. And again, there is a normal range of going to the toilet at night depending on certain ages, which we are going to go through. Some women experience that trying to get the key in the door, and they know they need to go to the toilet and they're rushing and they're rushing and they're rushing. And again, before they make it, they leak. All of these are signs and symptoms of something that is common but not normal. So we want to understand where you sit and what your symptoms look like. Understanding where you are in your life is also a really important part of understanding what may be contributing to your incontinence. Incontinence can affect anyone at any age, from young children to teenagers to women who are pregnant or postnatal. And then as we get older, our risk of incontinence increases due to hormone reduction, due to the perimenopause as well as the menopause. There's so many different factors, so understanding where you sit in life right now is also really, really important. So there are lots of reasons why women can experience incontinence, and it tends to never just be one reason. But some of the reasons include childbirth, pregnancy, postnatal, going through the perimenopause, the menopause. There's some genetic factors, having surgery, having other injuries like back pain or pelvic pain or weak core. And there's also lifestyle factors. So being overweight, having a poor lifestyle, having too much caffeine and poor nutrition, and also smoking. So these are just some of the reasons, but as I said, there are lots. So when we go through them, we are trying to find what sits more with where you are at right now. When we look at treating incontinence or leakage, again, it isn't just one treatment option. It is a holistic approach, a 360 approach, I like to call it. We need to look at what your lifestyle looks like. Are you healthy? Are you active? Do you exercise? What does your daily routine look like? Are you sedentary quite a lot? Do you work where you are lifting heavy objects a lot? Have you done or do you do any pelvic floor work? Do you know what your pelvic floor does? Do you eat well? Do you drink enough fluids or too much fluids, maybe with too much caffeine or alcohol? When we start to look and we start to break down the different elements of managing your incontinence, we need to put together and go through a range of different tasks that are going to help either eliminate or we can use as a contributing factor to start to adapt to improve your symptoms. So we will go through in another tutorial about your pelvic floor and why your pelvic floor muscles are so important when it comes to leakage. You can have pelvic floor muscles which are too tight, which means they hold on, or you can have pelvic floor muscles which are too weak. And a lot of women will experience weakening of the pelvic floor for some of the reasons I've mentioned. Pregnancy, the perimenopause, aging, the menopause. Pregnancy causes a weakening and excess load on the pelvic floor muscles. It's their job to support your pelvic organs, your bladder, your bowel, your uterus. With pregnancy and giving birth, whether it's vaginal or C-section, those muscles become weaker. Then postnatally, if we haven't recovered, if we haven't done any pelvic floor work, they're left weak. It's their job to support the bladder and the bowel. If they're not working, then it is putting us at risk of experiencing leakage, especially when we are active or when we cough. We do a sudden movement like a cough or a sneeze. So understanding the role of the pelvic floor and where that sits in terms of your recovery is really important. Just as we can have a weak pelvic floor, you can have a strong pelvic floor. If your pelvic floor, so if you are a young athlete, if you are somebody that's very active, if you run, if you are involved in impact sport, if you CrossFit, if you weight train, have very strong abdominals, experience other symptoms like pain during sex or constipation or pelvic pain, there is lots of other signs of pelvic dysfunction that can lead us and help possibly explain your reasons for incontinence. And this is why seeing a pelvic health physiotherapist is so important in terms of your recovery, because we can go through all of this with you. So understanding the role of your pelvic floor and how that plays is super important. Stretching, activity, being mobile is really important. Our body naturally will get stiff and get tight. If we have tightness through muscles, this can cause tightening of other muscles. When we have weakness, let's say when we are coughing or we sneezing, we need to get practicing our pelvic floor. We do our pelvic floor in lying to start with because it's the easiest position, but we need to get you doing exercises which challenge your pelvic floor quickly, over load and with demand. This is going to help to retrain them and get them back to doing what they were doing before your leakage started. The pelvic floor muscles are trained instinctively to contract and stop us from wetting ourselves when we don't need to go to the toilet, and then they're trained to relax when we do need to go. And because of the changes that occur in life cycles like pregnancy, like giving birth, like aging, then this can cause those muscles to become a bit lazy and forgetful. So practicing and retraining your pelvic floor is one method that's really important. On the other side, if you are a very high functioning person who is very active and has a pelvic floor that's working too hard, you may need to put into place relaxation methods, just like stretching, like breath work. It's going to help to calm down the pelvic floor, because if it is too tight all the time, it becomes weak. And then when we do quite sudden movements, that is where we can experience our leakage. So understanding the role of the pelvic floor, understanding where you sit in that pelvic floor spectrum, depending on where you were at, again, is going to give us an insight into where you are. If you are somebody that experiences urgency symptoms that need to go and you need to go now, one thing that you can start to implement straight away is just don't run. Instead, walk. You just have to start retraining your brain and your bladder to calm down. We will go through bladder retraining in more detail in another tutorial, but just simply start by walking to the toilet calmly. You will get there. You are going to retrain your brain, to retrain the bladder, to calm down. You are going to get to the toilet. You slowly approach the toilet, you turn around, and in a nice calm way, you take your bottoms and your underwear down, you sit on the toilet, and then you relax. This is a form of bladder retraining that we need to do, but just to softly, gently start implementing this rather than rush, slow down. If you ever feel that you don't fully empty when you go to the toilet, don't rush to get up. You can do some side to sides, you can do some forward and back, you can do a little bit of pelvic tilting, where we can just make sure that any little trickles of urine that are left in the bladder can fully empty. Okay, so don't be in a rush to go. Give yourself a couple of extra seconds and just make sure that you wiggle around, moving in different directions, forwards and back, side and side, some pelvic tilts, move the bladder, and just give yourself that time to fully empty. One of the other big top tips for managing bladder and bowel incontinence is making sure that we don't strain and that we avoid constipation. I will do a different tutorial on constipation in more detail, but it's really important that we avoid constipation at all costs because of the pressure it places into the pelvis and onto the organs and onto your pelvic floor. So making sure that you're drinking enough fluid and that you're eating a balanced diet. That means enough fiber, enough protein, enough carbohydrate, and enough foods that are going to help to keep your stool soft. One top tip that you can add in as well is if you do experience constipation is placing a step underneath your feet to raise your knees above your hip. This changes the rectal angle and helps you to go to the toilet more. Similarly, if you need to go for a wee, rather than rushing, again, it's something that mums do a lot and women in general, try to just calmly sit down onto the toilet, take a breath, gently release those pelvic floor muscles, okay? We don't want to be straining because again, this is causing increased pressure and stress onto the pelvic floor, onto your pelvic organs. So managing constipation and managing straining is really, really important. Other factors include looking at your hydration. Caffeine and foods and drinks which contain caffeine irritate the bladder. So I will go through again caffeine in a little bit more detail, but we want to make sure that you're not just having coffee and fizzy drinks and wine and chocolate and citrus fruits, all of which are bladder irritants. So we can go through and we can also start to look at trialing if we reduce or take some of those drinks and foods out, does it make a difference? But again, these are all things that your pelvic health physiotherapist will go through. So again, if you're watching this and thinking, I have this and I have this and I have this, then going and seeing your pelvic health physiotherapist is always the best thing for you to do. And then you can use PelviFit in line with your rehab and just giving you that information on repeat. Okay, so this is how we need to look at building your picture when it comes to what symptoms are you experiencing? Is it bladder? Is it bowel? Is it both? When are you experiencing those symptoms? How are they presenting themselves? And what does your lifestyle look like? Your activity level, your mobility level, your nutrition, your diet. If we start with these, we can start to get a really good picture of what you're experiencing and how we start to implement change. Okay, so I know it's a bit of a long one today, but it's really, really important because there are so many different forms of incontinence, but knowing that we can do so much about it is part of the empowerment of managing your pelvic health. And as you can tell with a lot of the things I've mentioned, there's a lot of really quick things that we can put in place to help improve your pelvic health, improve, if not get rid of your symptoms altogether. So if you have any questions, please feel free to reach out to me.